Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to talk about the impact of COVID-19 on personal finances and on business, but first, it's back to school.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers, and now, here's your host, Terry Madonna.
Well, welcome back. Well, we're going to start with schools. It's back to school time, and we're delighted to have Rich Askey. He's the president of the Pennsylvania State Education Association. They represent about 85,000 of the 200,000 educators in the state. I got that mostly right, I think.
Right.
Mostly right. Okay. Well, Rich, let's start with, we had remote learning last year. In many ways, it was unsatisfactory. I'm not going to be too critical of it. But do the teachers and support professionals, they obviously want to be back in the classroom.
I don't think anybody's any happier that the school bells are ringing again and the kids are coming into schools. We just want to make sure that it's done safely. There's a lot of protocols that have to be put in place. It's still important to mask up. It's still important to social distance. You know, we need to take care of our youngest citizens and make sure they're healthy.
Yeah. Well, let's go to masking in schools. As I think all of our, as our audience knows now, Governor Wolf has said to the Pennsylvania legislature, let's require it. You know, let's require it, not letting it up to each individual, each of the 500 school districts in the state, which is now where the decision gets made. And what's PSEA's position on the governor saying to the Pennsylvania legislature, mask up?
Well, so far we've been focused on the locals and helping our local associations work with school boards and administrations. But with this letter, we were in support of the letter. And the governor in this letter states that he's hearing from a lot of Pennsylvanians across the state that they want to make sure we're doing the best for our children. And the governor is following through with the request of the legislature to work closely with them on things like mandates and the safety of Pennsylvania citizenry. So we think it's imperative that they all do come together and they have a conversation about, are we doing the best for our schools and for our communities to keep them safe during this Delta variant surge?
Yeah. Well, there's one thing I think that's also important is just as we get with vaccines, where, you know, there are health reasons why you shouldn't get a vaccination if that's what your physician says. And similar to wearing masks, there are students who have asthma, students who have other kinds of problems, and they shouldn't be wearing masks. So that, and I noticed in the reports that I read, the news accounts that I read, I should say, that there was those exemptions were there.
Yeah, and we agree that they should be. There shouldn't be a one-size-fits-all. We're educators. We never believe in one-size-fits-all. But we do believe in those that can get vaccinated should. We, as an association, have encouraged our members to get vaccinated, and we would predict that they're at 85 to 90% vaccinated of our membership now as they return to school. It's just, we always teach our kids to make good choices. That's all we want people to do. Make a good choice.
Yeah. Yeah, and as we know, it's really hard to keep children, and I'll even go into colleges where I spent most of my life, keeping them separate is not easy. I mean, it's just the nature of the interaction that takes place in schools and on college campuses. Yes, no?
Well, I have heard of some difficulty, but I've also heard of many successes where just the layout, I'm getting pictures of the classroom layouts as teachers share how they set up their classrooms. The creativity in having desks separated and in a good space, it's just amazing to look at what our members are doing.
All right, we're going to run to a break. When we come back, I want to talk about vaccines or testing and what you think ought to occur in the schools in regards to those issues, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education. bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Rich Askey, the president of the Pennsylvania State Education Association, is my guest. And before we get to the whole issue of vaccines or testing, you know, when the governor said let's have a state mandate for I mean, should it be done at the local level or the state level, or is it just get it done?
Well, we were hoping to have it done at the local level, but as the governor states in his letter, there's just a handful of districts that have made masking protocols in their schools. A lot of the health and safety plans districts submitted don't address masks at all. So it is necessary to have some guidance from our leadership, not just the governor, but also I think he did the right thing by asking the legislators to be part of that conversation.
Okay. All right, let's talk to vaccines. And what have you been telling your members? Do you think it ought to be required? I know you've been recommending it, but go ahead and talk about that.
Right. We feel that at this point we feel that it should be at the local level, because those are discussions that districts should have with the local leadership, the local teachers and support professionals to set up protocols if they decide that they want to put in a a vaccination mandate that everybody can agree on and so that the goal can be achieved.
Yeah, I mean, that's a tough, when you mandate vaccines, I would hope that people who are able, willing, should get the vaccines. We got to be careful. Some people have autoimmune diseases and, their doctors say don't do it. But this is an important question about whether we should mandate it. And, that's hugely controversial. I think you would agree.
Absolutely. But I also think that we have to remember that we're protecting not only ourselves, but we're protecting our kids.
Yeah.
And every layer of protection that you can give to those children is important to do. We want these kids to be in school on day 1, day 30, all the way to day 180. We want the kids to be in school, and we don't want to see them quarantined.
Well, as you point out, a large percentage of teachers are already vaccinated. So, and remember, I've been reading more and more about how young folks get COVID-19, but they're asymptomatic, but they can pass it along. But even now, more and more young kids are getting it. And the death rate's still, thank God, relatively low, but they can pass it along, and they do end up in the hospital.
Yes, well, as a matter of fact, I have a niece that works in a children's emergency room in Miami, Florida.
Oh, wow.
Yeah, and some of the conversations I've had with her, it's very distressing. And we don't want to see this happen in Pennsylvania. We don't want to bring it here. We want to do everything that we can to make schools safe. And this Delta variant is something that targets the youngest people.
All right, I have to ask you about something that was certainly in the news, and that remote learning last year. But there was a learning loss as well that everybody has identified. Where does that all stand, the learning loss from last year?
Well, we're looking at it as more of a learning gap, because we're going to fill that gap up, and school districts are working very hard to do that. They've already had summer programs. They're now moving curriculum around and finding out ways. They're testing kids in informal methods to make sure where the children are. And all we want is, my message to schools, to administrators, is to make sure that the people who know the kids best are at the table when those decisions are made.
That's an important point, because you got to go back to the teachers and the other professionals who are involved in the learning process.
Right.
And plus, there needs to be equipment changes, I would presume. Now remember, we're still at this distance point, and so you need educational technology and a whole variety of things.
Yeah, there's, certainly we saw an uptick in technology in school. So take what we learned over the past year and bring it back into in-person learning. But also remember with health and wellness and everything, as they make these plans, make sure they include school psychologists, counselors, nurses, and those paras that work with like the special ed children. They observe a lot that their voice is important as well.
All right, we have less than a minute. Teachers' mental health. This is having an effect on so many of us, but mental health is certainly critical.
Yeah, we are aware that our teachers have been and educators have been so stressed over this pandemic, and on top of all of that, they had to do hybrid learning and all these other things to keep connected to their students. So all we want is to make sure that districts make sure that they have plans in place to help their employees with stress, and we as an association have done the same thing.
Sure.
We've been having like Wellness Wednesdays, Thoughtful Thursdays, things like that to help our members.
Thanks for coming in. Keep us updated. All right, when we come back from the break, we're going to talk about the impact that COVID-19 has had on personal finances, and what about business? We'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by CrossState Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, COVID-19 has had a big impact on our finances, but it also has had a big impact on businesses. So the gentlemen who are going to help me understand this, and all of us, sitting across from me is Patrick Conway. He's the president and CEO of the CrossState Credit Union Association, and Ken Dyer, he's the CEO of AmeriChoice Federal Credit Union. Did I get that right?
Exactly right.
All right, Patrick, let's start with you. There is no doubt that the environment is very complicated right now, and folks, are out there are saying, well, what do we do? Let's talk about the personal finance aspect with my own personal finances and where they stand and what the future is like. But there is help out there.
There is help, Terry. And, in this global pandemic that we've been living through the last year and a half, financial education has never been more important. And credit unions, community banks are really the trusted financial advisors for citizens across the Commonwealth and the country. And, with unemployment spiking throughout the pandemic and the changing environment, both economically and health-wise, understanding financial well-being and, guiding your financial life in a productive manner is critically important.
Yeah. And the other aspect about it is that, it looks like that when we examine the biggest impact that COVID-19 has had, we're talking about leisure, we're talking about hospitality, we're talking about retail, manufacturing, construction, and I won't even get into the help wanted signs. So you can't go anywhere and not see them, correct?
Well, it's really hard to get qualified people to do the work that's necessary for our members. And it's important for us to stay focused on our members' well-being. And part of that well-being is having really qualified people understand first the focus is on our members. Focus is on their financial well-being. And how do we put them in a position to be successful in finding the right people? A challenge, but a challenge that we're up to because we can optimize our work environment. We can do remote people that are supporting our member services, and we'll do things like walk-up windows, and anything we can do to serve the members is what we'll do, and we'll figure it out.
Yeah, and to his point, Patrick, there's a question of personal financial education, and we tend to push that off to the side. But getting counseling we often talk about counseling for mental health, which is a big and very important, but now it's financial education counseling that's also significant.
Absolutely. And again, it's never more important than today. And, it's important to start that financial education at an early age.
Yeah.
So, for example, many credit unions are in school districts, 285 school districts across the Commonwealth with in-school credit union branches. So we have that access. We've got counselors that are going into these school districts to help provide that counseling to students. We're conducting financial reality fairs, many financial leaders in our communities across the state. And it makes it a fun way for young adults to learn. But for families, it's critically important.
And professionals, too few parents get into financial counseling. I'm trying to think if I did it with my son and my daughter through it. But that's important at an early age.
And teens say that 71% of teens say that they get financial education from their parents. The interesting statistic is that 33% of the parents say that they deliver it. So I don't know how to kind of reconcile those two things, but to be able to bring forward the things that are important, for things that they can talk about, to give them some ideas of how to set goals, how to do budgets, what's important, what's not, good debt and bad debt, so they can have talking points to really have a discussion and to bring family finances into the front.
Well, look, let's run to a break. When we come back, let's talk about one-to-one financial counseling. I mean, we get into this issue where we have, done sometimes in classes, sometimes, but one-on-one counseling, it seems to me, is probably very, very significant. And we'll get to that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
Well, welcome back. I'm not going to diss, parents sitting down with their kids and chatting about personal finances and what they ought to do about investment and savings. But one-on-one financial counseling is also important.
It's incredibly important, not only to set goals and understand where you are. I think statistics will kind of help us understand the depth of this problem. And 75% of Americans live paycheck to paycheck. I'm not exactly sure what that means, but what I do know is 40% could not come up with $400 in an emergency. Our ability as credit unions and financial institutions to support the planning that allows them to have an emergency fund is really important. One or the other, and I don't want to bury you in statistics, but employers and employees spend 2 to 3 days of their work day worried about finances. That's a $5,000 a year impact.
And the pandemic has made that all worse, correct?
It's really challenging for people not knowing. We can plan for what we know. We can plan for some life events, but we can't plan specifically for the events like a pandemic and how that's going to impact our families and their financial future.
Good point. Well, let's talk about small businesses, financial education for them. It's critically important, and how has that been working out?
Well, again, like families throughout the pandemic, Terry, small businesses have also struggled. Credit unions, the financial services industry advocated for the PPP program, which has been very helpful. But businesses have had to navigate through. They've had to reduce expenses as their revenue has dropped. So having a good financial plan for a small business is equally important to that of a household. So financial institutions, at the community level can be a great resource. They can be the trusted financial advisor for small businesses, just like they are for families.
Yeah. Have you seen an uptick in terms of the individuals who have come to you and sought assistance?
We have, and it's them coming to us and saying, I don't know what I don't know. Tell me what I can do.
I don't know what I don't know.
And so if we can help them explore what their goals are and some of those things one-on-one, and we have a program which is a personal financial analysis that allows people to say, well, what's my debt situation? What's my income situation? How do I set goals? And what are those goals? whether they're a member of ours or not a member, they can come to us for that assistance, and we can put together a plan that says, how do they save money? How do they take that savings and put it into an emergency fund? How do they save for their unique needs going forward?
Yeah.
So it's a really popular program for us.
Yeah. Patrick, that has to have an effect on mental health as well. I mean, the stress that's created. We had the Secretary of Corrections on last week, and he talked about a large percentage of inmates who have mental health issues. So the stress related to the success or the failure of a business has to be just enormously important.
It does. It absolutely does. Mental health is very closely linked with your financial well-being. In fact, we have worked with the Department of Corrections at the state level to do financial counseling for inmates that are coming out of our state prisons back, re-entering the communities. And so, that sort of giving back and providing that financial guidance is a big part of what credit unions are doing in the community to help provide that sort of, safety net for people coming out back into society.
Yeah. Well, one other topic that I think is important is people are getting exploited. And perhaps the elderly get more exploited than the rest of us. Explain that.
Well, sadly, that's true. 1 in 5 elders will experience some kind of financial exploitation. And it comes from so many different sources, outside sources. It comes from social media, connections that are made there. It comes from family members. So to the extent that our credit unions and our small institutions can be part of an AAR safe banking program, be certified through training to be able to identify, to be able to escalate when necessary, to be able to support elders as they go through their financial journey, and to be able to do that and not be caught up in exploitation that can devastate their savings.
And that exploitation takes place in many forms. Every day I probably get 2 or 3 phone calls, scams, with people trying to sell me something, and I don't know if is the elderly any more susceptible to that? I mean, I just say I appreciate the phone call, but send me whatever you want to get, whatever you want me to do, send it by mail.
and they are more susceptible, and that's why these bad actors target the elderly. And they do go after them with those things, and they try to get them to take steps that they shouldn't take. And it's important for the rest of us as a society to try to be helpful to those folks. So it's really a problem. And, as Ken was saying, it's always a problem. But I think in the pandemic, many elderly have been even more isolated. So it's even more of a problem today.
All right. Well, these are very important topics, and I'm glad you could come in to talk about them. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.